Welcome to this month's episode of Got Teeth. I am Cheyenne Olson from Crestmont Dental, and I'm here today with our lovely hygienist, Nicole, and she is here to educate us about myofunctional therapy. All right, so what is myofunctional therapy?
So orofacial myofunctional therapy is very similar to physical therapy for your mouth, basically. So what can happen is people can develop things called orofacial myofunctional disorders, and this can affect the growth and development of your jaw, the way your teeth come in, and your skeleton actually. So basically what myofunctional therapy is you would be working with me. I'm a myofunctional therapist and training candidate, and basically we would be meeting for about 12 sessions over 6 months, and we would just be assessing any muscular disorders that you have going on in your mouth, in your face, and in your lips. So ideally you want to be having a high tongue posture, you want to be having a proper swallow pattern, and you want to be having a proper lip seal, which promotes nasal breathing. So kind of those are the 4 main goals of myofunctional therapy. And what I would do is I would work with the patients, to assess what kind of orofacial myofunctional disorders you might have going on, and how we can basically work together to fix those and make your mouth, your swallowing functioning better, and most importantly, I would say your breathing, making sure that you're nasal breathing.
That's huge.
Yeah.
So as a hygienist, you're lucky enough to spend a lot of time with our patients, usually at least an hour, sometimes longer. So when you're working, doing your periodontal maintenance appointments, what tips you off that somebody may benefit from myofunctional therapy?
That's a great question. I would definitely say number 1 is looking at the tissues. So seeing if they're red, if they're inflamed from a periodontal point of view, right? Like we're trying to fight gingivitis. But if you're doing all you can to be flossing and brushing, but you're still having generalized inflammation in your mouth, why is that? Are you mouth breathing? So mouth breathing actually dries out your tissues and changes your oral microbiome. So you're not having this healthy saliva flow going over your gums and your teeth, and this can cause more gingivitis. It can affect a stable periodontum, so affect your bone levels. It can also increase your rate of decay. So if I'm seeing clients who are having a high rate of decay, their mouth breathing, that's automatically a tip off, right? Also, as a dental hygienist, we're not just looking at your teeth and your gums, right? We're actually assessing all of your soft tissue. So I'm looking at your throat, your tonsils, and if I'm noticing your tonsils are large and obstructing your airway, then I start asking these questions. Are you snoring? Are you sleeping well at night? Are you possibly at risk for sleep apnea? Are you mouth breathing or nasal breathing? Because like I mentioned earlier, myofunctional therapy, one of the main goals and focuses is to be nasal breathing. And so basically the field of myofunctional therapy has really grown out of people researching how can we prevent sleep apnea, obstructive sleep apnea. So a lot of research comes out of that, right? So basically those are some of the things I'm looking at with patients to assess if they're having these myofunctional disorders. Another thing is a strong gag reflex. So Dr. Olson is at Crestmont. She works with a lot of sedation patients, and I would say a lot of them struggle with like a strong gag reflex, right?
Yeah. They're having to be put under to get their dental treatment because they can't tolerate anything in their mouth.
Yeah, and that's a huge struggle for people, and that's totally fair. And so some patients I see, it's actually working on reducing that gag reflex. And so what these exercises do in myofunctional therapy is we work on your tongue tone. So we do these exercises that actually isolate your tongue muscle and give you more control. So, and sometimes it could be a matter of also if they have tethered oral tissues. So like that tongue tie underneath your tongue there. If you have a strong tongue tie, sometimes it could be working with you to identify that tongue tie and then referring you to a practitioner who could release that for you. And seeing me, a myofunctional therapist or any other therapist who can basically work on that muscle tone with you, and teach you how to use your tongue again in a way. So it's very fascinating. Also, people who have a strong gag reflex, they could also be dealing with, they just don't have a lot of tongue space in their mouth. And that has kind of happened because as humans, as we've hit the Industrial Revolution, as we have more processed foods, our jaws are actually shrinking a bit. So you notice more patients don't have room for their wisdom teeth, right?
Absolutely, all the time.
Yeah, so also patients have crowding of their teeth, and a lot of this is just because our jaws are naturally developing smaller and smaller. So identifying early on with children, and identifying, okay, is there too much crowding here? Is their jaw too narrow? Do we need to get them maybe not into a myofunctional therapy program, but assess and giving them some early interventions like myobrace or myomunchie, and getting them working on expanding their jaws a little bit, or referring to the orthodontist to get them into palatal expanders, so that when they age, their jaws grow nicely and they don't have this issue of lacking tongue space, having a strong gag reflex, all of these things. It's all connected, and it's really interesting stuff.
You mentioned a few times there nasal breathing in particular. I've actually had some mom friends of mine, who are worried about their kids because they notice issues with their sleep, and they notice that their mouth is open, and it's something I think is being talked about more, so they've had questions. But what is the importance of nasal breathing? Why is that something that we're focusing so much on?
Nasal breathing is extremely important. So basically, if you're nasal breathing, you are inhaling through your nose. Our noses are lined with natural cilia, so kind of like hair, and that will trap allergens, environmental allergens, pollutions, things like that. So it reduces any kind of nasal congestion. So right off the bat, that's one benefit of nasal breathing. Another benefit of nasal breathing is when you're breathing through your nose, your body actually receives more oxygen. What happens is nasal breathing allows your body to convert the oxygen into something called nitric oxide. And we all need nitric oxide for every functioning system in our body, for our nervous system, digestive system, cardiovascular system. So when you're mouth breathing, you're not getting nearly as much nitric oxide. And this can affect a lot of things, especially sleeping is a big one. So if you are sleeping and you're nasal breathing, your body is going into this rest and digest state. And that's when we get into those deeper sleep cycles of REM sleep. You wake up feeling rested, you're not fatigued, you've had a good solid sleep, right? You're getting enough oxygen. If you're not getting enough oxygen, what can happen if you're mouth breathing, you're not getting enough oxygen, you aren't going into that rest and digest state, and it's actually activating your other nervous system. And so you're not sleeping as deeply. You could be waking up feeling fatigued. And some people, it could be affecting their hormones. It could even be maybe inducing a little bit of anxiety, and it's not because of, it's just anxiety. It's like, no, you actually need more oxygen. Your body's kind of can be starving for that oxygen sometimes. And so people with sleep apnea, you see them having like the CPAP machines, and so that's giving them the constant flow of oxygen, and that's helping them stay sleeping and rested. And so myofunctional therapy can really help promote that nasal breathing, and also, like I said, kind of train your tongue to get out of the way and make sure that, you're getting enough oxygen with nasal breathing. It's so important. Even beyond the sleeping, nasal breathing helps your muscles receive more oxygen. So say if you're an athlete, there was a guy who ran the Boston Marathon or something like that, or another marathon, and he mouth taped. And he ran the whole marathon with tape on his mouth, which I cannot imagine.
That's amazing. That's incredible.
But basically, because he knows his body is receiving more oxygen, making his endurance longer, it's allowing his muscles to basically restore better so he can keep running. And there's a lot of research coming out, and you might have heard of, well, we've heard of James Nestor, right?
Yes.
He came to our last Trek retreat, which was amazing. And he wrote that book called Breath, and he's a journalist. So he didn't really come at it from maybe a healthcare perspective, which we would be used to, but this book is very comprehensive for anybody to read, and he talks about the importance of nasal breathing. And there's also a couple other books. Patrick McEwen is a really great resource. He wrote a book called The Oxygen Advantage, and it's more for athletes, I'd say, but anyone can read it again. And just talking about the benefits of nasal breathing and how it's so important for us. I think, what's his name, Joe Rogan, he did a podcast.
And Huberman.
Andrew Huberman.
Hot topic.
Yeah, it's a huge, it's definitely a hot topic right now, and mouth taping is becoming really popular, and there's so much science behind it. And I think from my perspective as a hygienist and a myofunctional therapist candidate, it's a great way to talk to patients about the importance of nasal breathing and how myofunctional therapy can help them.
I think a lot of our patients and their parents have really benefited from you as part of the multidisciplinary team of even if there's something else going on, maybe tonsils are a problem or orthodontic problems, you've been so beneficial to educate our team, our patients about the importance of maybe intervening on that. And hopefully when we're addressing that younger in life, maybe they don't necessarily need to go through these major things later on, like CPAPs and things like that if this is managed early. So
yeah,
I think that's been hugely beneficial, which is really great. So what does a myofunctional therapy appointment really look like? What does that even mean? How do I explain that to people?
Yes, that's a great question. So basically, patients would come in for the consultation. It takes about an hour, give or take, and I just take a lot of measurements, ask a lot of questions. Have you had your tonsils removed? Do you have any allergies? Do you have digestive issues? Because that can also affect nasal breathing, myofunctional therapy, digestive issues. It's all connected. So I ask them things about that. Like I said, I take a lot of measurements. Where are your jaw? Where are your teeth sitting? Ask them questions, where is your tongue sitting? Is it in the floor of your mouth or is it nice and high? Because like I mentioned, our tongues should be always high, front, middle, back, resting tongue posture. And then I do a 3-minute breath hold test. So I kind of test people to see if they can nasal breathe for 3 minutes. Because if they can't nasal breathe for 3 minutes, then in that case, we might be referring to like an ear, nose, and throat specialist to see, okay, what's obstructing their ability to nasal breathe? Is tonsils and adenoids a problem? Do they have a deviated septum? Things like that.
I read about that 3-minute nasal breathing
Yes.
test. I think in James Nestor's book.
Yes.
How would somebody, if they wanted to do a simple test at home, what would that look like?
Basically, what you could do is you could take a popsicle stick and kind of like hold it in between your lips and then start a 3-minute timer and see if you can nasal breathe for 3 minutes. Yeah.
I thought it would be a breeze. I thought I was a nasal breather. Nicole put me through her entire consultation, and I was surprised to find out that it wasn't as easy or as mindless as I thought it would be. So the whole consultation, I mean, I consider myself pretty well versed in this area, and I definitely learned a lot. And that was one of the main takeaways I had. Was I think I could use some work on my nasal breathing.
Yeah, maybe we all could. Honestly.
Yeah, we all could.
So that's the consultation, and then from there we decide, okay, do you want to do this comprehensive program? And the program would look like us meeting for about 12 sessions, give or take. Meet for maybe 30 to 40 minutes a session, and every 2 weeks, 2-3 weeks. And basically what I do is we practice nasal clearing exercises if we need to, making sure you know how to keep your nasal passages clear, looking at, do we need to get you a little nasal inhaler, some little menthol, clear those passages. Those are super helpful. And then I give you exercises. So typically it's 3 to 4 exercises, and we're working on isolating your different muscles in your mouth, primarily, the tongue, and also working on the lips. And these exercises basically are retraining. It's a neuromuscular retraining of your muscles to promote proper functioning of your mouth, of your orofacial muscles. So we do mouth exercises, we do face exercises, we're winking, stuff like that, which a lot of people can't even do.
That's me.
Yeah, it's hard. Some of these exercises seem really simple, and then you try to do them and you're like, oh, this is actually kind of challenging. So yeah, basically I'm giving you new exercises every week, and we're practicing them and practicing the old exercises. So what a patient would do is meet with me, go over the new exercises, and then go home, and every day in between those 2 weeks is they're practicing for about 5 to 10 minutes a day. Usually I recommend practice 1 round of exercises in the morning, takes about 5 minutes, and then practice 5 minutes of exercises in the evening, and that's it. So it doesn't require a lot of your time, but it definitely requires a lot of dedication. And these exercises should be done, in the mirror, so you can see how your face is moving, how your muscles are functioning, and making sure you're not compensating anywhere. So one thing I struggle with is when I'm doing these exercises, my neck gets really tense. And that's one of the things that we work on, is like relieving tension, isolating muscles. And within the myofunctional exercises, I also like to encourage people to go to other providers, maybe like chiropractors, maybe not physical therapists, depending on their need, but massage therapists, cranial sacral therapists, even acupuncture, to maybe wake up muscles and also relieve any tension that needs to be relieved. So the cool thing about myofunctional therapy is it can be very interdisciplinary with the practitioners you're working with, right? You can be working with dentists, orthodontists, and all of those other kind of body workers who I talked about. So yeah, it's really cool. And at the end of the 12 sessions, so about 6 months, hopefully you are having good lip seal, nasal breathing 24/7, your tongue posture is high, and we actually also work on swallowing. So the girls kind of laugh at me at the office because I come in with like applesauce, and I came in with chips a couple weeks ago. And we're actually, doing exercises and learning how to swallow properly. So it's really interesting stuff.
Yeah. The first thing I thought of when you said 12 sessions in 6 months, as somebody who's been through physiotherapy and I can barely comply with my 15 minutes of exercises over 5 sessions. Obviously, this is something that requires some commitment and dedication, but it seems like the patients that you've been treating have been giving you such good feedback. What's some of the feedback that you're getting from people who've gone through your program?
Definitely. So these people are very motivated, and they're dedicated, and they're consistent. And like any training or exercise, if you are not consistent in doing the work, you're not really going to get much of an outcome. So that's something to consider if you're wanting to do myofunctional therapy. But one thing I think I've seen is patients so happy with, oh, I know where my tongue is sitting, and it's higher, and it's less tension on my jaw. And even some patients saying like, my stomach issues have been settling down a little bit as I've been swallowing less air because I'm chewing properly, my tongue posture is high. That's a really cool one. And I think for me to have these patients say, I'm seeing the benefit, I feel like I'm breathing better, I feel like my stomach feels better, and I feel like I have less tension, like that is, when people say that, it just kind of like, I feel so happy for them, because I can see the benefit of myofunctional therapy, but I want these people to feel like all of this hard work that they've put in, they're seeing the benefit of it. It's really important. So yeah, I've had some really good feedback, and the clients I have been working with are very happy with their progress so far. And I'm excited to see with some of the new clients I'm taking on, and with future clients, this is a whole, learning journey for me too. And there is so much to myofunctional therapy, and still so much more that I want to learn, and I can't wait to learn it and give that to the clients, and just basically increase their overall like wellness. Because when you're breathing properly and functioning properly with your mouth, it really affects everything, right? I mean, as dental providers, we know that the mouth is kind of like a telescope into what's going on with the rest of your body, right? Sometimes we can tell if people are having maybe cardiovascular issues, even if their gums aren't healing properly, things like that. So I think starting with the mouth and getting all of these things functioning well, your breathing functioning well, and having patients feeling better and seeing the benefits is a great thing.
Mm-hmm. No, it's obvious you're very passionate about this. I learn so much from her all the time. You're just filled with so much knowledge, and it's life-changing. We're trying to create health for our patients, and these things, they seem minor, where your tongue sits in your mouth, if your lips are open and that kind of thing, but when you talk about these outcomes of what making changes can do, it's really remarkable what's possible. And we're just so lucky that you have this knowledge base and that you can offer this and educate people on it. It's really a game changer. So it's wonderful.
Thank you. And thanks for giving me the opportunity
to
do it.
Of course. Of course. As soon as we started talking about it, I knew this was something we had to get into and bring more, right? Like it's, I think, ignorant to not be addressing this with patients if we're noticing these kinds of problems, whether it's you being the fixer or whether we're educating them and referring them to somewhere else, like a sleep clinic or something. But
yes, definitely.
It's major.
Yeah, I agree.
Yeah. Any final thoughts?
I don't think so. I think basically if you felt like anything resonated with you today, you can definitely contact us over at Crestmont Dental, and we can get you booked in for a consult with me. And if not with me, there are plenty of other providers in the city who are practicing myofunctional therapy, who are very passionate and knowledgeable about it. And I really think that it's a growing field. And honestly, I think in a couple years, it's going to be much more known. So it's a great field. And just do some research, do a little bit more research if you're interested in it. And thank you for giving me the opportunity to talk about this today.
Yeah, thank you so much, Nicole. That was awesome. Very, very enlightening.